Hey guys, it's Leah Buckles from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss atrial fibrillation, often referred to as AFib, and sleep apnea, and how those two relate in VA disability. So there are many veterans that are service connected for atrial fibrillation or other cardiac arrhythmias, and they can be connected on a primary or secondary basis. And so we're going to get into some of that. But first, I want to talk about what atrial fibrillation is, right? So atrial fibrillation, defined by the Center for Disease and Control, is the most common type of treated heart arrhythmia, and it's when the heart beats too slow or too fast or in an irregular way. That's what an arrhythmia is. AFib is when a person has AFib, the normal beating of the upper chambers of the heart, or the atria, are in a regular pattern, and the blood doesn't flow as well as it should from the atria to the lower chambers of the heart, which are the two ventricles. Okay. AFib may happen in brief episodes, or it can become a permanent condition. Okay. So that was from the CDC, or the Center for Disease Control. Again, there are several different kinds of cardiac arrhythmias people can suffer from and be service connected for. Atrial fibrillation is one of the more common ones. It's a more common cardiac arrhythmia. It can be idiopathic, or we don't know why it's caused, or it can be related to other medical conditions. Okay. So on a direct basis or a primary basis, people can be service connected for atrial fibrillation if they were diagnosed while they were on active duty. So if you served for 20 years, if you served for 5 years or whatever, and you were diagnosed and you didn't have the condition prior to service, or perhaps you can always show that a condition was aggravated by your service in some way, whatever that way may be, if it pre-existed your service. Most of these that I have seen, if they were directly service connected, it's due to them being diagnosed in service, not a worsening of a pre-existing condition, because usually those types of conditions can be disqualifying. Not always, but you would imagine a condition that causes irregularities of the heart on a sustained basis might be a disqualifying condition. So anyhow, that's on a primary basis. Somebody was diagnosed with it in service, or perhaps it was aggravated by their service in any way if it was pre-existing. Okay, so on a secondary basis, we can see people that have gotten this condition maybe later in life or due to another service-connected condition. The ones that there are many conditions that can cause or be related to or aggravate or worsen atrial fibrillation, but the ones that I see the most common are obstructive sleep apnea, and mental health conditions like PTSD or different stress-related disorders. So, okay, of course, we always have to look at what are the other risk factors, what were the circumstances surrounding it, et cetera. But today I want to talk about obstructive sleep apnea in particular and how that one can be related. Okay, so I'm going to go over a couple of the pieces of literature that I use when I'm looking at letters for this. So remember that nexus letters are never required. They can just often be helpful. And so some of these pieces of literature you can go take a look at, maybe take to your treating doctor and see if they agree or disagree or whatever, and maybe they can help you with a letter, or you can look up some of these articles and submit them, etc. Okay, so the first article that I have is called Obstructive Sleep Apnea and Cardiovascular Disease in Adults. It's published in UpToDate, and it's in the section on atrial fibrillation. It states a strong association, up to 4-fold higher odds, between OSA and atrial fibrillation, independent of obesity and other confounding influences, has been described in multiple studies, and limited observational data suggests that OSA may be a modifiable risk factor for recurrent atrial fibrillation after cardioversion or ablation. There's some more language about that, but that's one piece of literature that we use from UpToDate, which is a great resource for medical professionals. Another article, Atrial Fibrillation and Sleep Apnea, Considerations for a Dual Epidemic, published in 2016 in the Journal of Atrial Fibrillation, discusses both obstructive and central sleep apnea being associated with AFib in multiple studies, with the risk of atrial fibrillation increasing 2 to 4-fold compared to those without sleep breathing related disorders. It goes on and on to discuss it. The proposed mechanism by which hypoxia promotes AFib is via autonomic nervous system dysfunction and electrical remodeling. And so there's a bunch of language about how there's a causative relationship there, okay? There's just several studies, and another one, the Journal of American College of Cardiology and Clinical Electrophysiology from 2015. discusses more than 1,000 patients with AFib and sleep apnea demonstrated compelling evidence that CPAP significantly reduces episodes of AFib. So a lot of times we'll see this in people that have untreated sleep apnea for a number of years, okay, that it's not treated. It's undiagnosed, they can develop it. And oftentimes that's one of the signs that get people to go and they start having that and then they get a workup for sleep apnea, okay? So we've talked about some of those research articles that show an association. Maybe later on we'll do one related to atrial fibrillation and stress. Real quick, I want to touch on the ratings. These are always subject to change. You want to follow up with a legal professional like an attorney or an accredited claims agent on this. I am not a legal professional. I'm a medical professional. I have done CNP exams in the past, and I assist with these types of letters now. I don't ever advise veterans on stuff like that, but I just, review medical records and write reports. So atrial fibrillation is rated under schedule of ratings for cardiovascular system. And so at the 30% level, it's paroxysmal atrial fibrillation or other supraventricular tachycardias, other types of arrhythmias, not all, but this is a specific type, with more than 4 episodes a year documented by ECG or Holter monitor. That's the 30% level. And then 10% is if you have permanent AFib or 1 to 4 episodes per year of paroxysmal atrial fibrillation or other supraventricular tachycardias documented by ECG or Holter monitor. So I hope this was helpful to some of you guys. Please drop some comments if you have any questions about this. If you'd like to get in touch with us, reach out anytime. Check out our website. You can email us at info@prestigeveteranmctx.com. Thank you for watching. Please leave some comments if there are some specific videos you'd like to hear about, and talk to you guys soon.